All right, so first things first, we're gonna start out with a lumbar exam here. If you would, I want you to take your computer and just set it on the floor for the beginning of this. That's perfect right there. Take a few steps back. I want you to go as far as you can to your right. And I just want to check your gait out here. So walk over then as far as you can in front of you. Very good. Kind of go back and forth one more time for me if you would. Good. And just stop right in the center there and face me. Okay. Next thing we're going to do, I'm going to have you kind of come up on your heels and your toes. So if you would, just like this, in just a few steps on your toes. Very good. And if you would come up on your heels and just a few steps on your heels next. All right, very good. Now I'm going to have you face me again, if you would. I'm just going to have you bend forward as far as you can, fingers to the floor, if you can. Let me know what you feel with that.
Ooh, left low back pain.
All right, and just take a few steps away from that wall there, and I want you to bend backwards as far as you can then. What about that?
Yeah, that same side, left side.
Okay, and maybe come over this way, go into that left side. Same thing?
Yeah, that left side, painful.
What about this way?
Not so bad.
Okay, now I want you to rotate. What do you feel going to the left?
Nothing to the left. Right's okay too. No pain.
Okay. All right, very good. Next thing we're going to do, I'm going to have you, if you would, bring that computer back up on your table, and I'm going to have you take a seat right in front of it then. All right. So we're going to start with a bit of a neurologic evaluation here, just testing strength. So I'm going to have you, if you would, just lift that right knee up into your hand. I want you to push down into it.
Okay.
Very good. And we're going to compare side to side here. Just do it side to side. If you need to do it another time, you can. Does it feel about the same?
Yeah, both strong.
All right, hands on the outside of your knees here, and I want you to push out into your hands next.
Okay.
Very good. Same thing, about the same side to side.
Mm-hmm.
All right, and the inside of your knees next. Bringing them in just like that. Very good. Strong throughout.
Yep.
All right, very good. Now we're going to do a sensory exam. We're going to start up higher, almost close to your hips here. You're just going to light touch over your thighs here, okay? Going all the way down to your knee. Now is that about the same side to side here?
Mm-hmm. Yeah, I can feel everything.
Next, I want you just on the outside of your shin here, comparing side to side again.
Yeah, I can feel that on both sides.
All right, and the inside, on the inside, side to side here.
Mm-hmm.
All right, very good. Next thing we're going to do is we're going to move those hips around a little bit here. So I'm going to have you, if you would, bring that knee up to your chest as far as you can like this. Start on that right side. Okay with that?
Nope.
All right, same thing over on the left side. Bring it up like this.
Oh, yeah, that's
Same
that
thing with
left low back pain.
Go back, you said?
Yeah.
Okay. Next thing we're going to do is bring the right one up again, but this time you're going to try to bring it up to your other shoulder. Yeah. And relax. Any pain with that one?
No, not on that side.
Okay. Same thing on the other side, up and over to the other shoulder.
Oh, yeah, that left back.
Low back, you said?
Yeah.
Now I'm going to have you just in that seated position, just bring this leg up and kind of let it rest there. Start with that right side.
Okay.
All right. Any pain with that?
Mm-mm.
All right. Apply just a little overpressure here and let me know what you're feeling with that then.
Feels okay. A little stretch.
Okay. Same thing on the other side here. Just kind of put it up, let it rest. Any pain with that?
Feels a little tight in the back, yeah.
Just tightness, no pain?
Mm-mm.
What about if you apply just a little bit of overpressure here?
Oh yeah,
That's
that makes that left low back pain.
Worse? Okay. All right, next thing I want to do, I want to see exactly where this is bothering you. And I want you to kind of poke around those tissues, if you would kind of lift your shirt up and just show me exactly where you're feeling that pain.
Right
And
in
is it
there.
tender in your toe there?
Yeah, right in here. I can feel it.
All right, what about if you go a little bit below there, kind of in your upper buttock area? Is that tender too?
Tight, definitely if I push out here. Not as painful, but tight.
Okay. And then come up just above where you're feeling that pain too, almost in the kind of lower back area. Yep, just right there. Any pain when you do that?
Yeah, a little more painful than the buttock, but not as bad as right here.
Okay.
Yeah.
Great. Oh, okay, gotcha. All right, that's it. The lumbar spine exam.